Healthcare providers at Michigan Medicine serve a critical role in the care of transgender patients. Let's look at how healthcare providers across disciplines can provide excellent care to all patients regardless of gender. We will talk about 5 opportunities for providers to ensure their care is gender affirming: use of names and pronouns, guidance for taking a history, special considerations for mental health care, tips for physical exams, and bystander responsibilities. We'll start by talking about names and pronouns.
Come in.
Hi, Mr. Lee. It's Dr. Chrisman. It's nice to meet you.
Hello.
How can I help you today, sir?
Well, I was hoping that you could take a look at a rash which has recently developed on my right breast.
Of course, sir. I'd be happy to take a look.
And Dr. Chrisman, I would appreciate it if you don't refer to me as Mr. or he. My name is Mauve. You can call me Mauve. You can call me Miss Lee, but I don't use male pronouns.
Mauve, I am so sorry. I do apologize if I was using the wrong name or pronouns.
Thank you.
Of course.
Misgendering, or addressing people using the wrong gendered language, can be avoided by not using gendered terms like Miss, Mr., Sir, etc., and by asking people what they would like to be called. Because your assumptions about someone's gender may be incorrect, greet people kindly without using gender markers. When you are meeting a patient for the first time and do not know what they prefer to be called, the best practice is to ask them how they would like to be addressed. We all know individuals who were, for example, named Catherine at birth, but use and strongly identify with the name Kate or Katie, and not as Catherine. Regardless of gender, the name a patient uses can be documented in my chart as their preferred name. Though this is labeled preferred name in my chart, it is better thought of as simply the patient's name. If a patient has changed their legal name, they can be referred to clerical and registration staff who can change one's legal name in the medical record system with the appropriate documentation. Addressing patients in a way that is congruent with who they are shows patients that we respect them and their identities. For patients who are transgender, using the correct name and pronouns are of particular importance. Please be especially aware in waiting rooms and public spaces. Addressing a patient incorrectly in public can out or expose the person as gender nonconforming and can lead to unsafe situations. If you make a mistake or misgender someone, apologize. Apologies should typically be sincere, short, and discreet. Let's try that last interaction again with a different approach.
Hi, it's Dr. Chrisman. May I come in?
Sure.
Hi, my name's Dr. Chrisman. It's nice to meet you. What would you like to be called?
I'm Mauve.
Mauve. Is Lee the right last name?
That's correct.
Great. Just to make sure that I have the right chart, can you please confirm your birth date for me?
Sure. My birth date is 4/4/1980.
Okay.
I
Great.
don't use my legal name.
Okay. Well, I'd be happy to have Mauve changed as your preferred name in our system.
That would be great. Is it also possible that you could indicate in my file that I prefer she and her? That would really be helpful.
That's not a problem at all, Mauve. We can have your name, pronouns, and gender identity switched in our system. It is important to know that in some areas of the health system, they still may use the name from your insurance records, and this name may appear on printed materials.
Okay.
But please, we are really working on trying to get this changed.
That's terrific.
Also, when I do switch your name and the pronouns in the system, hopefully, and it should, those names and pronouns will appear on any communicated material, such as a letter sent to your home.
That's fine. Thank you for letting me know.
Of course.
Next, we'll talk about tips for taking a medical history.
I'm hoping that you can take a look at a rash which has recently developed on my right breast.
Of course, Mauve, that won't be a problem. Is it okay if I review your medical history so that I can make sure I have all the pertinent, relevant information?
Well, sure. I'm in pretty good health.
Okay. I see here down for medical history, you have seasonal allergies, and then chondroplasty listed for surgery. Are there any other medical problems or surgeries that you've had?
No, not at all.
Okay. Mauve, have you had genital reconstruction done?
I'd rather that you focus just on the rash, Doctor.
Regardless of one's intentions, asking questions about one's gender transition or genitals when not directly related to their concern is inappropriate. When taking a history, focus on what is relevant. If a question about someone's transition, anatomy, or experience being transgender isn't directly relevant to their medical care, don't ask it. When thinking about a patient's medical history, mental health concerns of transgender patients also deserves mention. In 2012, the Diagnostic and Statistical Manual of Mental Disorders, DSM, removed gender identity disorder as a mental health diagnosis. With this change, the mental health and medical community acknowledge that being transgender is not a mental health disorder. Mental health concerns endorsed by a patient should not be automatically assumed to be related to their gender identity. To describe emotional stress related to the incongruence between one's gender identity and sex assigned at birth, the DSM includes the diagnosis gender dysphoria. This stress is attributed to societal gender expectations. Social support, such as family acceptance, is associated with improved mental health outcomes in the transgender population. Let's move on to tips for physical exams.
Okay, let's take a look at this rash.
Yeah, it just recently developed under my bra line on my right breast.
Is it okay if you'd be able to take your arm out of the right side of your gown so that I could look at the area of the affected breast?
Sure.
Here, the provider did a good job of mirroring the language the patient uses for their body parts, in this case the term breast. In other situations, if the patient uses the term chest, for example, it would be appropriate to mirror that language. The provider also gave the patient control of exposing the area of the body to be examined. These are good practices for any patient population. Let's look at another patient exam interaction.
So the order says that you're here for a pelvic ultrasound. Is that correct?
Yeah, that's correct. I'm thinking about trying to get pregnant, but my doctor said they couldn't find the string to my IUD.
Okay. All right. Okay, well, I guess we just need to do an ultrasound. I'm just going to put this probe on your belly and we'll see if we can find your IUD. Okay. I'll just have you lay back here. And then if you could sort of lift your shirt up, and then I'm just going to put this on your belly here. I've never done an exam quite like this before.
In the last scene, the person running the ultrasound used body language, intonation, and comments that could easily make a patient feel othered or judged. Small changes in body language, including eye contact and awkwardness with physical exams, send strong signals to patients about whether they are safe and accepted. Let's look at that scenario again with a few subtle changes.
So it looks like the order says that you're here for a pelvic ultrasound. Is that correct?
Yes, I'm thinking about trying to get pregnant, but I need to get my IUD out and my doctor couldn't find the strings.
Okay. Well, we're going to do an ultrasound today. We'll use a probe on your abdomen to see if we can figure out where your IUD is.
Okay.
Okay. So I'll just have you kick your feet up here and go ahead and lay back for me. And then if you could lift your shirt up a little bit, this might be cold, okay? Okay, a little bit of pressure. All right.
We'll end by talking about bystander responsibilities. The patient we met earlier, Mauve, got her rash evaluated, but unfortunately got in a terrible accident on the way home and is now in the emergency department going through a trauma evaluation. Mauve is seriously injured. In this scene, emergency department staff are talking about next steps in her care.
We're going to need to keep Mauve lying flat, and we're going to need to place a Foley. So Megan, can you place that Foley, please?
Seriously? On this lady, ma'am? Who knows what's down there?
Right? Better you than me.
This is inappropriate language and is not acceptable. The University of Michigan has a comprehensive non-discrimination policy and does not discriminate against individuals on the basis of gender identity, gender expression, or any other legally protected basis. If you are a bystander and overhear this type of language, it's your job as a team member, regardless of role, to speak up. Discriminatory and derogatory speech and behaviors should be reported to your supervisor and are grounds for disciplinary action. If you do not feel comfortable talking to your supervisor, please contact the Patient Civil Rights Coordinator. Let's look at that scene again, this time with bystander intervention.
So we're going to need to keep Mauve lying flat and to place a Foley. Megan, can you get the Foley placed, please?
seriously. And this lady man, who knows what's down there?
Megan, the language you just used is completely unacceptable and inappropriate. It violates Michigan's non-discrimination policy. Maeve's our patient, she deserves our respect, and I'm gonna need to talk to her supervisor about this. Please leave. I'll take care of Mose Foley.
Beyond individual patient encounters, you play a key role in setting the tone in clinic and departments about how gender-affirming care and gender non-conforming patients are discussed. Your work is critical in helping transgender patients feel safe and welcome in our health system. To recap, to ensure we provide excellent care to all people regardless of gender. Avoid assumptions about gendered language. Apologize if you accidentally misgender someone. Call people by the names they request to be called. Reflect this in your charting and update demographic information in My Chart as needed. Recognize the difference between sex assigned at birth and gender identity and document accordingly in My Chart. Questions about one's transition or genitals should only be asked when medically necessary, not simply out of curiosity. Mirror patient language during physical exams. Ensure that your body language and words show that you are non-judgmental and accepting. And speak up if you hear a colleague acting or speaking in a discriminatory or derogatory way. For those interested in learning more about gender-affirming care, resources including the World Professional Association for Transgender Health and the publicly available guidelines for the primary and gender-affirming care of transgender and gender non-binary people on the UCSF Center of Excellence for Transgender Health homepage may be of use.